December 2017 and there's been a cholera outbreak in Yemen. Over 1 million people have been affected with around 2,230 deaths. This is by far the largest number of people affected by cholera recently. We are going to be following epidemiologist Shivam Patel as he studies the outbreak and helps contain it. But first, let's talk to a local physician to learn more about how the outbreak began.
My clinic knew there was an outbreak starting when numerous patients started coming in complaining of the same symptoms: rapid heart rate, low blood pressure, thirst, muscle cramps, dry mucous membranes, and a loss of skin elasticity. Some physiological effects of cholera include rapid loss of salts such as sodium, chloride, and potassium, leading to muscle cramps, low blood volume causing a drop in blood pressure, and a drop in the amount of oxygen in your body. If untreated, this can cause death in a matter of minutes. Dehydration can cause several symptoms such as irritability, lethargy, sunken eyes, a dry mouth, extreme thirst, dry and shriveled skin. This is one of our patients, Seisha.
I haven't been able to leave the room for days. So much diarrhea.
The diagnosis for cholera can be done by taking a stool sample and running an immunochromatographic dipstick test, where we place a dipstick in the stool sample and observe the number of red lines it reads. If it reads 1, then God bless. But if it's 2, that means you're one of the infected ones. We can also diagnose cholera by running a blood test for antibodies against Vibrio cholerae, the bacteria that causes cholera. Now we're going to test Seisha's sample.
Fascinating. While the test is being conducted, let's talk to our epidemiologist, Shivam Patel, to learn about how the disease was able to spread so quickly in Yemen.
Cholera spreads through drinking water and food that has been contaminated, usually by the feces of an infected person that contains cholera bacteria. Because of this, it can spread rapidly in areas with inadequate treatment of sewage and drinking water, such as Yemen, where more than 8 million people lack access to clean water.
What advice do you give to people who have not yet been affected and want to protect themselves from this terrible disease?
People who live in that area that has been contaminated or is currently affected by cholera should only drink water that is bottled, sealed, that has not been broken, boiled, or chemically treated. Also, only use bottled, boiled, or chemically treated water to wash dishes, brush your teeth, wash and prepare for food, or make ice. Also, avoid tap water, fountain drinks, and ice cubes. Wash your hands often with soap and clean water, especially before you eat or prepare food and after using the bathroom. Eat foods that are packaged or that has been freshly cooked and served hot. No raw or undercooked meats, seafoods, or fruits and vegetables unless the fruits and vegetables are peeled.
Great to know. Stay tuned to learn about treatment and prevention. We'll be right back after this commercial break.
Don't be like me. Disinfect your own water. Add 2 drops of bleach or a half tablet of iodine and boil it for a minute.
So, doctor, what efforts are in place to help treat those who have been affected by this disease?
We have set up diarrhea treatment units and oral rehydration points, which prompt restoration of lost fluids and salts through rehydration therapy and help with the symptoms of dehydration. We are also providing antibiotics to patients with severe cases of cholera. These antibiotics will help kill the bacteria, Vibrio cholerae, that causes the disease. The antibiotics will reduce the fluid requirements of this disease and the duration of the illness. Doxycycline is recommended as a first line of treatment for adults, while azithromycin is recommended as a first line treatment for children and pregnant women. Mr. Patel's team has a prevention plan running in surrounding areas that has not yet been affected.
Mr. Patel, can you tell us more about your prevention plan?
Identifying water systems and wells that have been contaminated allows the water to be purified and stops people from drinking the infected water. We are constantly monitoring water in surrounding areas, using biological and chemical tests, as well as educating the local people about cholera, how they can protect themselves, and how to use chlorine water tablets we are supplying to ensure that their water is safe to drink. Community health volunteers have been identifying suspected cholera cases and refer to them in the nearest health facility.
Unfortunately, relief workers have faced many obstacles. Saudi Arabia closed highways, seaports, and airports in Yemen due to the war. This has cut off humanitarian groups from delivering chlorine tablets. More than half of healthcare facilities have closed because doctors and nurses are not getting paid.
Seisha, the results of the dipstick test came back. You have cholera.
This ain't it, Chief.
My clinic knew there was an outbreak